this tutorial we're going to look at the procedure for performing CPR and the use of an AED or defibrillator. It's important to remember when you have a person collapsed that the scene is safe around the person for you to approach as per our scene safety tutorial. My scene is safe, I'm now kneeling alongside the casualty, so the first thing I need to do is to see if my casualty is unresponsive. And I do that by doing shaking and shouting. Hello, can you hear me? No response. My casualty is unresponsive, I now need to get help. So will you go and dial 999 or 112, get a cardiac ambulance, get the defib and come back to me. Now that that's done, I need to check to see if my casualty is breathing. So I need to perform a head tilt chin lift. The hand nearest the head of the casualty goes on their forehead and 2 fingers on the bony prominence of the chin, and I'm going to tilt the head back, performing a head tilt chin lift. Now I'm going to check for breathing for no more than 5 seconds. 1, 2, 3, 4, 5. I'm also going to check for signs of life, and signs of life are coughing, breathing or movement. As my casualty have none of these, I'm now going to perform compressions on the casualty. So expose the chest fully. The correct hand position for CPR is in the middle of the nipple line on the center of the breastbone. I'm going to put the ball of my hand or the heel of my hand on the chest of the casualty, elbows and shoulders over the casualty. I'm at 90 degrees and I'm going to press the chest 5 centimeters. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And now I'm going to give 2 breaths. And I'm going to continue performing 30 compressions and 2 breaths until my defibrillator arrives. Once the defibrillator arrives, you stop and you use the defib. I'm going to turn it on by opening it. I'm checking the chest for the P's, which are patches, pendants, pastes, placemakers, piercings. If there's a chain, I'm just going to put it to the side. If there was a piercing, just keep the pad a centimetre away from it. And if there was patches like a nicotine patch or GTN patch, you remove the patch and you dry where it was with a cloth.
Tear open package and remove pads. Peel 1 pad from plastic liner.
I'm now going to place my pads on the casualty. I'm going to place them on as per the diagram. So the first one goes on the right hand side of the chest, just above the nipple line. And the second pad goes on the left hand side, below the armpit. Secure them in place. Okay, everyone stand clear. Stand clear, everyone. Everyone stand clear.
Do not touch patient. Analyzing rhythm. Do not touch patient. Analyzing rhythm. Shock advised. Charging. Stand clear. Push flashing button to deliver shock.
Okay, everyone stand clear. Stand clear, everyone. Everyone stand clear. Okay, I'm clear, you're clear, we're all clear.
Push flashing button to deliver shock. Shock delivered.
Once the shock is delivered, you go straight back and you start compressions again. 30 to 2. The defib or AED will stop and allow for 2 minutes of CPR, and it will analyse again after the 2 minutes. Our sequence of CPR and the AED, you're going to keep doing that until the casualty recovers, more advanced help arrives, the doctor, the ambulance service arrives, or you're physically unable to continue yourself. If the casualty recovers in front of you, you're going to turn off the defib or close the lid. You're going to check for breathing again. 2, 3. And my casualty is breathing, so I'm now going to place him in the recovery position as per our recovery tutorial. A couple of important points to remember. The depth of our compressions is 5 centimeters. It's at a rate of 30 compressions and 2 breaths.